Welcome to a Healthy Push podcast. I'm Shannon Jackson, former anxiety sufferer turned adventure mom and anxiety recovery coach. I struggled with anxiety, panic disorder, and agoraphobia for 15 years. And now I help people to push past the stuff that I used to struggle with. Each week, I'll be sharing real and honest conversations along with actionable and practical steps that you can take to help you push past your anxious thoughts, the symptoms, panic, and fears. Welcome. You're right where you're meant to be. Okay, today I have another really awesome guest with me, and we're going to chat about panic attacks. So I am so excited to welcome Dr. Martin Brunet here with me. He's a general practitioner who works for the National Health Service in the UK. So if you're like, what's that? You can translate it to Martin is a family doctor. So, Martin, welcome to a Healthy Push podcast.
Brilliant. Thank you very much, Shannon. Delighted to be with you and amazing to be across the Atlantic like this.
Right. I'm so excited. When I came across your Instagram, I was like, dang, the way that you present things, it's just so great. So practical, like just very easy to digest. So I'm really excited just to hear your perspective on a lot of different things. So let's just start with what are panic attacks and like what happens physiologically in your body when you have a panic attack?
Yeah. So I think I see panic attacks really they're anxiety on steroids, if you like. So a lot of what you're going to feel when you're having a panic attack is similar to when you have anxiety, but it kind of builds up and it crescendos and then overwhelms you when it's a full panic attack. So
Mhm.
So a lot of the symptoms, if you have anxiety, you might be familiar with them in a low level, but normally you can manage them. And there are two main causes of the symptoms, and I find it quite helpful to think about it like this, and then it helps me understand the different types of symptoms. So basically, it's to do with adrenaline or epinephrine. Is it called epinephrine in America rather than adrenaline? Um,
Yep.
I have to remember how to translate. And it's to do with our breathing. So adrenaline, epinephrine, this is our flight, fright, fight hormone. This is the hormone that gets released when we need to do stuff and do exciting or dangerous stuff. And we're all very familiar with it when we run for a bus or we're very excited about something because we're watching our favorite football team or something. Adrenaline kicks in and it makes our heart race and it makes us potentially a bit shaky. It will brings blood to the skin, so we might get flushed. It can upset the bowels, so we're all familiar with, having to rush to the toilet because we're nervous before an interview or something. Well, that's adrenaline affecting the bowels. So it affects the whole body. And if you're running for a bus or doing something where you expect to have adrenaline, then that's fine. You expect your heart rate to race. But it's when you're getting adrenaline when you're just sitting doing nothing and it's really racing. And then you feel your heart going fast and really pounding away and you feel very shaky and sweaty and just ill. And sometimes a sense of an impending sense of doom is a term that's used to describe panic. And that a lot of that all relates to adrenaline. And I think of it as adrenaline without a purpose, which is why it can feel so overwhelming because you're not about to fight something or run away. You just feel panicked. So
Yeah.
part of it is adrenaline. And then the other part is to do with your breathing. So one of the things that we do, we tend to breathe faster. And part of that is adrenaline makes us breathe faster because if you're going to run for a bus, you want to breathe faster. But when we breathe too fast, then we breathe in more oxygen, which is fine. Doesn't matter how much oxygen you have, but we breathe out carbon dioxide. And when we breathe out carbon dioxide, that changes the acidity of our blood, which is not dangerous, but it gives you all sorts of unpleasant symptoms. So particularly it makes you lightheaded and dizzy. It often gives you tingling in your fingertips and your toes, and sometimes the end of your nose. And if you really push breathing far too fast, you can even get what's called tetany, which is where your muscles cramp up and feel like they're locking. But you've got to really do a lot of hyperventilation before you get that. But the tingling and the lightheadedness are very, very common. So that's
Yeah.
the majority of the symptoms.
Yeah. I'm glad you hit on so many of them. And I'm sure people are like, yes, I've experienced this. That, what you said, adrenaline without a purpose, it is so good because I think the most frustrating and scary part about struggling with panic disorder and having panic attacks is you know that they're not really happening for any good reason. And it can make it so incredibly hard because you're like, what? Like, I'm just standing here, right,
Mm.
in the store waiting in line. Like, why the heck is this happening?
Yeah.
And so I think that's sort of the next thing to roll into. Like, why do we get them, especially in those scenarios where it nothing is really warranting us to have this response, right?
Yeah. Yes. I think there's always a logic behind anxiety and panic, but it's not
Mm,
necessarily the one you'd expect. So often people would say, why are you worried? You've nothing to be worried about. Or why are you panicking? There's nothing to panic about. And it just doesn't really work like that. So I think there's always a difference between the very first panic attack you have and if you're prone to panic attacks and getting them regularly. So let's just say you're prone to panic attacks, you've had them before. You then just become conditioned to consciously and unconsciously, your brain links certain things with panicking. So if you panicked in a supermarket before, then everything about the supermarket will remind your brain about that time and it will feel a sense of threat. In the same way,
mm,
we've evolved to panic when there's an uncaged lion that might attack us. And so it makes a lot of sense that as soon as we see anything that looks vaguely lion shaped, we're ready to panic and run away. So it's instinctive that our brain then is on the lookout for that threat that left an imprint the last time we panicked. Um, and then you can find yourself thinking, well, there's nothing to be anxious about with going to a supermarket. But if you know that every time you go near a supermarket, you have a panic attack, actually, it becomes very logical to panic when you go to a supermarket because that's one of the most unpleasant things that can happen. So
right.
once you become conditioned, you don't need to look for any other reason as to why it's happening other than it's because I've become conditioned to have panic. I
Oh,
think,
that's so good because I think, right, we're always wanting to make sense of everything, right, and
mm,
analyze and figure things out, and we're like, "Why? Why is this happening? Why am I experiencing this symptom? Why am
mm,
I experiencing panic?" And so that's really helpful. And I always say, right, to acknowledge it makes sense. Like,
yeah,
as much as you don't like it and you don't want to be panicking, it makes sense that your
mm,
body's having this response, especially if you're putting yourself in a place or situation that often you experience anxiety or panic in. Um, the way you word things is so good. It's just like your brain is on the lookout, right? It's
mm,
like, and when it's had that proof, it just like heightens it all.
yeah.
You get that. I'm sure you've worked with people, right, where they've panicked here, there, and everywhere. And so they're like, I am no longer going here, there, and everywhere, which can then lead to that agoraphobia aspect.
Yeah, absolutely. Because it's such a frightening thing, the instinctive thing is to avoid anything that might cause panic. It's a
Yeah.
very natural thing. Think, well, I won't go to the supermarket, or I won't go on a train because I had a panic attack on the train. Actually, that just adds fuel to the fire and makes the panic have more power over you. And once you understand anxiety, the role of avoidance and how instinctive and yet damaging avoidance can be is something you've got
Mm.
to crack. But it's hard to crack it because everything in your instinct is saying avoid, avoid, avoid. Don't
Yeah.
have those feelings. So I think you're right.
Right.
Just reassuring yourself that it does make sense, and then not trying to analyze it too hard beyond that. But just say, okay, I'm panicking. I know, I know this happens. I know what's happening, and I can deal with it rather than trying to dissect it in its minutiae there and then. Is very
Right.
important, I think.
Right. So, what about that maybe first time? Because I
Mm,
think, people get really hung up on this. Like, I don't know why, I'm now struggling. And once you understand, physiologically what's happening, you can make sense of it.
yeah.
But I think when you have that first panic attack, a
Mm,
lot of people say, right, I didn't even know what was happening. I had no idea that I was having a panic attack. Why does that happen? Like, why do we just panic seemingly out of the middle of nowhere
yeah.
sometimes?
I mean, for some people, that first panic attack won't necessarily have an obvious cause, but I think it's often
Mm,
worth going back if you have panic to think, well, trying to remember the very first one, because there might be some stuff there that you can understand. So, for instance, it
Mm.
might be that your first ever panic attack was on a train. You had a stomach bug, so you had the runs. There wasn't a toilet, and you became really panicky that you were going to, have an accident on the train, which would be awful. And
Yeah.
and then whenever you go near a train, you start panicking. So sometimes there's something quite concrete like that, a traumatic event, or a thing that really made you very anxious in that situation that was unique to that time, but then you've now become conditioned. Sometimes I think it can be just the end result of burnout, for instance. Sometimes when someone's
Mm.
really stressed and burnt out and they've been going 100 miles an hour, then maybe they're on the commute to work and they suddenly, the journey getting close to that workplace that's really stressing them out starts to make the heart race, and they start then worrying about what's going on. I think one of the things about panic, especially if you've never had it before, is it feels so much like your body is physically falling apart, or
Mm.
something terrible is happening. So quite often, once your heart starts racing and you might start getting chest pains and your breathing's not right, well, you might well conclude that you're having a heart attack, or that you're about to die, or that something terrible's happening. And that's what makes it crescendo, because the panic itself gives you physical symptoms that are a good thing to panic about, because you're so unused to them, and they're quite scary. If your physical symptoms of a panic attack were just that your little toe started itching, you wouldn't panic about it. But because it
Right.
focuses on your chest, where your heart and your lungs are, and the really important bits, and then you feel dizzy and lightheaded, like you might pass out, and that's your brain. And so, that's very frightening.
Yeah. Yeah. And we create all these stories, right? I mean, I know everything that you were just saying. I was like bringing myself back to all the panic attacks I had. And I think even sometimes knowing physiologically what's happening, it like doesn't isn't helpful in the moment because you can't like talk logic into your brain when you're in that very anxious state. So
Yeah,
you're like, I know I'm not going to have a heart attack. I know I'm not going to, pass out and die, but I sort of can't convince myself of that.
yeah,
And
yes,
it's really unhelpful, right? To try to do that. It's like allowing it to make sense, right? It makes sense that my heart's racing. It makes sense that I feel shaky. It makes sense that I feel lightheaded and trying not to go along with all those stories. But that's, of course, incredibly hard when you're in that highly anxious state, right?
yes, yeah. No, it's very difficult. I think it's always important we don't tell ourselves we can't do something.
Mm,
Because if I say, well, I can't control my panic attacks, then, well, there's no point trying, because you can't. And there's no
yeah.
room for maneuver with can't. Whereas I find it very difficult to control my panic attacks. You can work with that. That allows you to imagine the possibility that you can overcome them and you can handle them. And I think
Yeah.
once we imagine that something's possible, that's the first step in actually being able to make progress.
Yeah. Yeah, for sure. I'm glad that you mentioned that burnout aspect because I think for me and I know for many people that I've worked with, it's sort of been this like slow burn of just like so much stress, so much overwhelm. And it made sense that your body got to this point where it was like, hey, I'm gonna throw all these, signals at you. And of course, if you don't know what it is, it can be super terrifying. And even if you know what it is, it can be really scary.
Yeah.
So, something that I hear a lot, and I'm curious what your thoughts are in this. People ask, right, is there any way to make it less scary? Like, I feel like the goal is I'm supposed to panic and feel really uncomfortable and really anxious, but I'm not supposed to be so scared by it. Like, how do I
Mm.
become less scared by it? Like, what are your thoughts on that? I'm curious.
Um, I think I think the first thing is just to understand it, to acknowledge it, to say, yeah, I'm having a panic attack, to remind yourself how you've managed before, because
Mm,
sometimes when you're thinking, well, shall I go and do that thing when I might panic? It can feel like having a panic attack would be a disaster, so therefore you don't want to do it. And yet, actually, if you go and do something and you panic, you will come through that, and that then gives you another successfully managed panic attack in the bank, if you like, that you can then remind yourself of. So, even if you have a bad day and you end up panicking a lot more than you thought, that's experiences in the bank that you can draw on when you panic another time and just say, okay, you know, when I've had panic attacks before, I've often thought, this is it, this is the end. Well, actually, it never has been. I've always come through them. I do know they pass. So you can go to past experience, definitely. Um, there's definitely techniques you can do to bring down your panic, and we'll talk about breathing. We'll come on to that, I'm sure, because that's very key. Managing
Yeah.
your breathing, um, and I think trying not to overinterpret it is important. So particularly with your physical symptoms, just reminding yourself, yeah, okay, this is adrenaline, this is my breathing, rather than my heart's going at 130. Last time it went at 140. Is that,
Right.
does that mean now I am having a heart attack? Or how do I know I'm not? You know, if you're asking yourself loads of what if questions, or how do I know if, that you need to try and steady that thinking, because it doesn't get you anywhere.
Right. It's like that what if, what if, what if? And, that was, oh gosh, I lived in that space. And I
Mm,
know so many people live in that space. And the thoughts can be so tricky because, the more you go along with the thoughts, there comes even more feelings. And you're like, oh my gosh, it just feels like this never ending loop.
mm,
Um, I, let's jump into that. So I'm curious, what can actually relieve panic? Because a little bit on what you touched on, right, was when you're panicking, right? You're sort of not you can't actually like make it go away, make it
mm,
stop when it's happening. And I think that's so much of what people are focused on when they're panicking. Like, how can I make this stop right now? How can I make
mm,
this go away? So,
yeah.
how can you actually allow yourself to like work through it in a way that's going to be helpful,
Mm.
not work against you?
And I think that's really important. There's two aspects as well. There's how can you help someone who's panicking,
Mm,
and then how can you help yourself? And I might start with the first one, because if you can imagine what someone else would do, then
mm,
maybe you can tap into that a bit as well. So when someone's panicking, if you're with someone who's panicking, the most useful thing you can do is be really calm. And so if I'm with someone who's having a panic attack, I need to talk them down. I'll deliberately slow my speech so that I talk nice and slowly, and just say things like, okay, you're having a panic attack. You're going to be okay. I'm here to help you. We'll come through this. And by talking slowly and calmly, the person panicking will get a sense of what you're saying and the tone and the mood of what you're saying far more easily than they will understand the words. Because when you're panicking, you're not really listening to the words, but you still sense tone. And and sometimes when I've seen panic attacks really get out of hand, it's when there's someone well-meaning who's trying to help, but they're doing it in either a panicked way themselves or in a slightly aggressive way. Stop panicking. What are you being so you're being silly? Stop doing this. Which is
just
understandable.
calm down.
Yeah, exactly. It's just so unhelpful. So, well, but if you just are completely calm yourself and make it clear that you're not thrown by this, then that's the most useful thing. So, and then you can talk to someone about helping their breathing. And I think breathing is really key. It's the first thing to work on, because you can't immediately slow your heart rate down. If I said change your heart rate, it's not something we're physiologically able to do. Um,
Right.
but you can gain control of your breathing. And what happens is the adrenaline makes you breathe fast, and then that gives you these awful symptoms because you're hyperventilating, you're overbreathing, the dizziness, the tingling, and then that makes you panic more. So if you can slow someone's breathing, and again, people sometimes get this wrong. So sometimes they think, oh, you've got to reach for a paper bag, so you rebreathe your carbon dioxide, and that's really not helpful. So don't reach for a paper bag. Sometimes they'll say, take deep breaths, and that means then someone goes from sort of to which is not very
Yeah.
helpful. You don't want to take
Let's
deep.
get even more lightheaded.
Yeah, exactly. So it's not deep breaths, it's slowing your breathing, and particularly slowing the breath out. What people, when they're panicking, they'll often breathe right at the top of their lungs. So they'll take little sharp pants in and they won't breathe out slowly enough, um, and and they won't be holding their breath between breaths at all. So if you can say, right, we're going to breathe really slowly, and talk someone through it. And there's a technique called box breathing, which you can do yourself, if you're the one having the panic attack. And it's if you imagine going around the outside or the inside of a box, and it's a square box, and each side is 3 seconds. And so when you go up one side, you breathe in and you take 3 seconds. So 1, 2, 3. And then the top and the bottom are holding your breath. So then hold your breath. 1, 2, 3. And then coming down the side, it's breathing out. 1, 2, 3. And then hold 1, 2, 3. And if you're with someone, you need to talk them through that, demonstrate it, but talk through the 1, 2, 3, and put your hands, show your hands going around the box. And you need to do it a few times. They won't be able to do it immediately, but if you keep doing that and just keep congratulating them when they do it right, don't tell them off when they do it wrong. But, you just congratulate them and say, "That's brilliant. You've held your breath really well there. Now we're going to breathe out. 1, 2, 3. That's fantastic. Now we're going to hold a breath again." And as they're going around just with encouragement, they can gradually slow down, and then they're more able to hear what you're saying. And then eventually, if you can get them to talk about, you're far better to get them to talk about, I don't know, the weather or something, or make a joke with them or something, rather than say, "Why are you panicking?" You don't want to talk about the panic, but
Right.
if someone's breathing's controlled well enough that they can then, just give you some banal information like, "Oh, where are you going?" or "What have you got on later?" or "Have you had your lunch?" Actually, it's quite hard to hyperventilate and talk at the same time. So once you can't get someone to talk when they're hyperventilating because they'll just be too panicked. But once you've brought their breathing down a bit, then you can get them talking, and then their breathing naturally starts to settle down. The
Yeah.
other big thing you can remind them, and again for yourself, is we're more likely to hyperventilate when we breathe through our mouth. We tend to do sighs through our mouth. We can breathe much more quickly through our mouth than our nose. So another thing you can just say is, right, close your mouth. We're just going to breathe through your nose, and to keep reminding them to breathe through the nose. So, and that's something, if you get used to doing it, that you can do yourself if you're really panicking, if you're over breathing. You can go back to nose breathing, and remember, box breathing is just a way of bringing yourself down.
Yeah. So I love that because I think that's, a lot of people who struggle with panic have a really hard time telling somebody too, like how they can be helped when they're feeling really anxious and panicky. And I always encourage like the ways that you find to be helpful for yourself to work through it, like communicating that to other people of what's helpful for you will help them to help
Mm.
you in those moments too. Because usually, of course, if you're struggling with panic disorder, you're very familiar with having panic attacks and
Yeah.
you sort of know what is helpful and what isn't helpful for you. And definitely not having somebody just tell you, calm down, you have nothing to be panicking about. It's
Yeah.
like, yeah, thanks. I know that. I'm very aware of that. So if somebody wants to help themselves, right? They don't have
Mm.
somebody with them to help them work through it. They're alone. What can they do themselves? Of course, in addition, because you can right slow things down,
Yes.
practice slowing things down, breathing, all of that.
So they can do that. I think another really key thing is how you think about your anxiety, and your panic, because we can we can imagine anxiety and panic in lots of different ways. And one, we might imagine it like, a monster that might jump out at us at any time, and we kind of hope it's not going to turn up. So we go and do the thing that makes us anxious, and we just hope it doesn't happen, hope it doesn't happen. And it's like we're running down Sniper Alley, and sometimes we get away with it, and sometimes we don't. And the trouble is, when the anxiety turns up, it all goes horribly wrong, and it's like everything falls apart. So that's not terribly helpful, but it's a very natural way to think about it. And another way we might think about it is, well, I've got to fight this anxiety. It's like a, a monster to be defeated, and I've got to somehow crush it. And the trouble is, I think, thinking about fighting and crushing and winning and defeating, that's all very aggressive terminology. And you've got enough aggression in terms of the adrenaline going on in your system, you don't really need any more. So I think that's not very helpful. But if you can imagine your anxiety, I think sometimes the term is objectifying your anxiety. So you imagine it in a certain way that actually helps you to see and picture your anxiety in a helpful way. So you can either see it, I quite like two analogies. One is where you have a daft, silly monster. Maybe you do imagine your anxiety as a monster, but you give it a silly name. Um, I, I've done a couple of reels on Instagram where call mine Wilbur. If anyone's listening and they're called Wilbur, I'm sorry. But the reason why Wilbur would work for me is I don't know anyone in my life called Wilbur. So it doesn't color who my anxiety
Right.
would be if I was imagining. And then I'd imagine it with, I don't know, silly teeth or, fluffy hair or something. And I'd imagine it coming with me and being there. Or you might imagine it like a yappy puppy that needs training and is naughty, but not something to hate and to try and push away or to be fearful for. So if you imagine your anxiety as something that is inherently not frightening, like a yappy puppy, I think that's a big start because then you go, okay, here's my anxiety again. Maybe you've called your yappy puppy, I don't know, Rover or Bilbo or who knows what. Um, but then you can say, okay,
These are fabulous names, Martin. Fabulous names.
the more daft they are, the more you can find yourself smiling when you think of it, rather
Yeah.
than screaming when you think of it, the better. I think there's a lot of. I love the concept of silliness and how being silly can actually be really helpful with helping us with our imaginations. And so, if we can think of our anxiety and our panic in a slightly silly way, and a slightly sort of recognize that it's sort of trying to help us, but it's a bit like a false alarm. So it's a bit like a smoke
Mhm.
alarm, or maybe your yappy puppy is trying to be a guard dog. The trouble is, it's going off at every bird that flies past the house, not just the burglars. So it's going off at the wrong time. It's not there, although it was designed to keep you safe. It's not actually firing off, keeping you safe. It's firing off all the time when it shouldn't be, and you just need to train it and help it to learn when to really start barking or yapping as this little puppy is, and when to be quiet. So I think that's just, it takes time to think, how do I imagine my anxiety? And you need to prepare yourself before you start panicking, because you're not going to imagine that for the first time in the middle of a panic attack. But if you train
Right.
yourself to think, oh, here's my panic, this is how I objectify it, that can be really helpful. I don't know if you've come across people who've used that technique successfully or.
Yeah. Yeah, and some people find it to be really helpful. I never personally did because I don't think anybody told me that
Mm,
back when I was struggling, but I can see how it would be really helpful. I sometimes had that response with my thoughts, like when the what if thoughts would get going, I'd be like, okay, yeah, thanks, brain. That's cute. That's silly.
yeah,
Like trying to make light of it and not, just going along with them. I do like that. I think that a lot of people find that to be helpful, and to some people find it to be helpful to sort of say, "All right, like let's panic, let's go
mm,
there, like show me what you got, let's do this,"
mm,
and allowing yourself to really bring it with you and have it be there, and like, "All right, Wilbur, let's just do this."
mm,
That some people have found that to be helpful. I think you hit on something that's really important though, and I think this goes along with the breathing too, is not just waiting until those anxious or panicky moments to practice.
yeah,
I think it's so incredibly helpful to practice these things when you're not in those anxious states so that your brain has that
mm,
opportunity to use the things that
yeah,
the tools. I think you hit on two really good things. Like one of the biggest things that was helpful for me was dropping that fight. Like I swear every time I panicked, I would have this armor, right? I would put all my armor on and be like, I am going to get rid of this. Like I
mm,
am going to destroy this thing. And I realized, after many, many times of having panic attacks, I don't know when it finally clicked, but it did, that like the panic wasn't the problem. I had
mm,
to stop putting up all the armor and
yeah,
fighting it and resisting it.
yeah,
And that was massive. And I think the other thing that you hit on is really big too, is like how you think about it, like not telling yourself, right? I'm going to go get in the car and go to the store and I'm not going to panic and I'm not going to feel anxious and it's going to be great and fine. I really like learned, okay, no,
Mm.
I have to reframe, right? I have to say we're going to go. We're probably going to feel anxious. We're probably even going to have a panic attack because we
Yeah,
usually do. And that's okay, but we're going to do it and we'll just see what it looks like. Like we
yeah,
don't know and we're going to try not to paint all the stories, but like let's take anxiety with us,
yeah,
not try to tell myself, right? I'm not going to panic. I'm going to be fine. I used to do that all the time
yeah.
and it didn't work.
No, it doesn't at all, but it's a natural thing to
Yeah.
assume. And
Right.
I love the concept of practice. I've been thinking a lot recently about the word, or the term exposure therapy, because
Mm.
exposure therapy, where you gradually allow yourself to experience the things that make you feel anxious, is one of the most helpful things for anxiety, where you stop avoiding, you start doing. But that word exposure is quite scary. When you're
Yeah.
exposed, it's not what you want generally. It implies all sorts of unpleasant scenarios if you start imagining what exposure might be. And
Yeah.
and yet, if it's kind of like practice, or I quite like the term anxiety rehab. It's a bit like, if you're an athlete and you're out of condition, you need to go and do your exercises. They're boring and
Mm.
they're painful, and you wish you didn't have to, but it's to do the goal of getting back on the track, or whatever sport you're in. And so, in the same way, you need to do mental health exercises. So you go and
Mm.
you practice, and that way you can almost say, well, I'm going to go to the supermarket if that's where you get anxious, for instance. I'm going to practice. I'm going to bring my anxiety with me. I'm expecting him to turn up or her to turn up, um, and almost it can be disappointing if she doesn't turn up, because then you think, oh, I didn't get to practice. When actually, when you start feeling anxious, say, yeah, that's good. I'm doing my exercises. I'm practicing, and that's how I, will gradually, you know, learn how to control and overcome this anxiety, and eventually, it will greatly lessen, and you'll find yourself doing stuff and thinking, gosh, I've even forgotten that made me anxious. Um,
Yeah.
so I love that
I
concept,
like that.
and also
Yeah.
recognizing
Yeah.
that you can practice the opposite. You can practice just worrying.
Mm.
And the more you practice worrying and fretting about, am I going to become anxious or not, um, the more your brain will just get used to worrying. So you're not trying to practice worry, trying to practice living alongside anxiety and being okay with it, and
Yeah.
when you
Ugh.
do stuff.
I like that. I like that a lot. I know because a lot of people find exposure therapy, of course, to be just like really, really hard. And yeah, you're right. It doesn't sound good. It doesn't sound like something that I want to do. But I like that. It's practicing, right? It's like rehab. Um, I'm curious, sort of one last thing that I want to ask, because I know I don't know, my brain's gone there. I'm sure others' brains have gone there. With you being a doctor, a GP, when somebody comes in to see you and says, like, I know that this is what I'm struggling with, right? I'm having panic attacks. I'm clearly struggling with panic disorder. Or maybe they don't know it and you help them figure that out, right? And give them the education. A lot of people have had that experience of, okay, great, you're struggling with panic attacks. Here's some medication.
Yeah,
This is what's going to be helpful for
yeah,
you.
yeah,
What are your thoughts on
mm,
medication for
yeah.
panic disorder?
So yes, it's very natural that people might say, look, could I just have something so I feel calmer? Um,
Yeah.
and there are two. If you're going to talk about medication, there would be two strategies. One would be, I wanted to have a pill that I could take when I'm anxious that calms me, or the other would be, is there a pill I could take all the time that would help with my anxiety? And it's interesting that the first feels like less of a deal, because you're not going to take it all the time. I'm only going to take it when I'm anxious. But generally, it's not a great idea. And that's for two reasons. One is we don't have very good tablets to do that. We have Valium, diazepam, that works very well. It will make you feel calm, but it's very addictive and you'll just get used to it. And the other one that we sometimes use are beta blockers, which don't make your brain any calmer, but they calm, basically, they block the effect of adrenaline, epinephrine, and so
Mhm.
that can reduce the physical symptoms. Might have a little bit of a place, although the guidelines on anxiety don't actually recommend them. But even if they work brilliantly, even if I had a sugar pill that would make you feel calmer and had no side effects, perfectly safe, you're not learning how to manage your anxiety yourself. You're not being empowered by taking a pill. You're just managing to do the thing by taking the pill rather than learning. So you're not practicing, you're not learning, you're not gaining anything. So I'd say that sort of pill has very limited value. Now, it might be useful to have a beta blocker if you're going for one interview that's scaring you, or an exam or something, but it's definitely limited value. The other type of medication that doctors will prescribe, and I do prescribe when it's appropriate, is antidepressants. It's not very helpful that they're called antidepressants when actually we'll often use them just for anxiety. But this would be tablets like sertraline, citalopram, fluoxetine, those sorts of tablets, and they they have a place because sometimes you're so overwhelmed by anxiety, you want to engage in therapy, but you can't do it. You can't concentrate. You're just frazzled, and something that brings down your overall level of overwhelm can then mean you can engage in the treatment. That's the real thing that's going to help you overcome. So they're the tablets that you have to take all the time for 6 months or so. I think they're not a panacea. They're not for everyone, and they're certainly not a substitute for trying to develop the skills to learn to to manage your anxiety. They might be something that helps you in the shorter term. So, yeah, for
Yeah.
anxiety particularly, I think talking therapy and learning about your anxiety and learning how to manage it is always the more important thing, the medication. But also,
Yeah.
the other thing I'd say, it's very important we don't stigmatize medication for mental health, because people stigmatize themselves about it and they often feel very bad about being on tablets. Or whenever I post something on Instagram about antidepressants, most people are find it very helpful, but there's always going to be one or two people that will just say they're a terrible drug, no one should ever be on them, and I just that always saddens me, because for some people taking an antidepressant has changed their life, and it made a big difference to them. So we mustn't have stigma on medication, but neither should we just prescribe drugs because either the doctor or the patient don't want to do the really important stuff, which is learn how to manage your anxiety.
Oh, so good. You said all the things. I have nothing else to say on that. So, Martin, this has been such a good conversation. If people want to find you, connect with you, learn more from you, watch your really good reels that you have on Instagram, where can people find and connect with you?
And so on Instagram, I'm at doc_Martin_GP. If you just search for Doc Martin, you'll find an actor, Martin Clunes, who's in a British TV soap about, well, not soap, it's a comedy program about a terrible GP. So you don't want to find him. But Doc Martin GP on Instagram is where I post most of my reels. I'm venturing onto TikTok at the moment, but I'm pretty new there. Still haven't really worked it out. It's a bit scary if you ask me. So I am writing a book about anxiety and burnout. It's just gone to the publisher. It's being published by JKP Publishing, and it's going to be out in about a year's time. So it's not out yet, but it will cover a lot of this sort of thing. Why do we get anxiety? The fact that it makes sense. It's this. So often I have patients come to me and they say, "I know it's stupid, doctor, but," because they're
Yep.
embarrassed about their anxiety. And actually your anxiety makes perfect sense, and that's a big part of it. But then also understanding that avoidance makes sense, and yet it really isn't a great idea, and how to manage that. There's a bit about burnout, and then there's going to be bits on our breathing, on sleep, on CBT, on medication. So yeah, watch this space. If anyone's interested in it coming out, then if you follow me on Instagram, you will definitely hear before it comes, and it should be out within 12 months.
Awesome. I love it. Well, thanks again, Martin, for coming on. It's been such a good conversation.
Yeah, brilliant. No, thank you for inviting me, and carry on the work you do. I think you have a great podcast, and you're doing a really good
Oh,
service. So keep that up.
oh, thanks. Thank you. I hope you enjoyed this episode of A Healthy Push. If you want more, head on over to ahealthypush.com for the show notes and lots more tips, tools, and inspiration that will support your recovery. And if you're hoping for me to cover a certain topic, be sure to join my Instagram community at A Healthy Push and let me know in the comments what you want to hear next.